Dear colleagues, I would like to appetize you to have a look into this webinar lecture because we talk about a very important issue in the field of implant dentistry, and that is implant placement post-extraction in the aesthetic zone. And we talk about single tooth replacement, and we talk about when immediate, when early, and when late implant placement. This is a very important indication in the field of implant therapy. It is a demanding clinical situation, either advanced or complex, and as I will show you, the timing is absolutely crucial. When you do this kind of treatments, you need to understand the tissue biology. That means the rich alterations you get post-extraction. We will explain to you the fundamental studies by Mauricio Araújo from Brazil. He conducted together with Professor Jan Linde. And I will explain to you in detail also the beautiful study by Vivienne Chapuis from the University of Bern, where she could show that in the aesthetic zone, the bone resorption in thin wall phenotypes is quite significant. And this bone resorption needs to be corrected and compensated for, otherwise you are running into problems. Okay, then we're gonna discuss in length the various treatment options you have. These treatment options should be based, or the decision for the treatment you're gonna choose is based on the local anatomy, and these will be explained in full details. These various options, immediate, early or late, is based on 3 ITI consensus conferences in 2003, 2008 and 2013, and published in corresponding proceedings in IJOMI. Okay, immediate implant placement can be done in ideal cases, and then it should be done flapless, because then this is really for the patient an absolute excellent treatment approach, because it offers the least morbidity, and patient has from the first day of surgery then a fixed restoration in his mouth. You see, you can get very nice results, as this case of Dr. Stephen Chen and Anthony Dickinson clearly show. But the indications are limited, because you should only use that in ideal cases. Then much more often we are using early implant placement. That is when you have a thin facial wall or a damaged facial wall, and that's quite often the case. And then we're going to wait 4 to 8 weeks of soft tissue healing. It has been described in this paper in 2008, and we're going to explain in detail the advantages of that approach. Last but not least, there is also late implant placement when you have patient or site-specific reasons for that. That's not very often. That's about 2%. Can be a young patient, adolescent, you see, too young for implant treatment. And here we clearly prefer to use then a socket grafting and ridge preservation technique in order to slow down the extent of bone resorption in that area, because when you place then later the implant, you don't have to go for staged ridge augmentation procedures. So this can be a huge bone lesion like this cyst, or as I said, adolescent patients, and you see even in case with cyst, it takes time, but you can get very nice results as indicated in this patient with that large cyst, 6 years follow-up. So when we summarize, and I will explain that to you, all the indications for immediate placement, all the indications for early placement, and the rare indications for late implant placement. The goal is to choose a treatment approach that will offer you an excellent treatment outcome with high predictability and with a low risk of complications. Have a look, step in, and you will see you will not be disappointed.
For more education programs, visit the Guide Institute at www.guidedental.com.